I learned something humbling the night Mrs. Alvarez fell in our hallway. We'd finished her appointment, I'd stepped out to print instructions, and moments later, I heard the thud, the kind that makes every clinician sprint. She hadn't tripped over a cord or slipped on a spill. It was quieter, simpler. Soft soles on slick tile, a quick head turn, a body that couldn't correct fast enough. As I helped her sit up, she apologized. "I'm so clumsy, doctor." And my heart broke a little. She wasn't clumsy. Her balance system had been slowly undermined by habits no one warned her about. That night, I promised myself to say the unpretty parts out loud, especially to my older patients, who deserve the truth wrapped in kindness. Before we begin, a clear note. This video is for educational purposes only and not medical advice. Use it to prepare smarter questions and safer routines, then personalize your plan with your clinician. And because this channel is a real conversation, tell me in the comments, how old are you and where are you watching from? I read them all. Your answers map the world we're protecting together. Today, I'm counting down 10 balance-wrecking mistakes I see every week in clinic, moving from 10 to 1. I'll give you the story, the science in plain English, and a simple fix you can start today. When we reach number 4, you'll see the habit that more than any other hides catastrophic falls in plain sight. Let's begin. Number 10, wearing unstable or worn-out footwear. I wish shoes were just fashion. For older bodies, they're architecture. Loose backless slippers, slick leather soles, squashed cushioning, and tired tread make every step a negotiation. Younger ankles have quick reflexes and fat pads that rebound. After 60, proprioception, the body's inner GPS, fades. Reaction time slows and thin soles send harsher signals to joints. Research in the Journal of the American Geriatric Society has linked poor footwear to higher fall rates in community-dwelling older adults, not because shoes are evil, but because they quietly erase traction and ankle feedback right when you need it most. Eunice is 74, a retired art teacher who adored her floppy house slippers. One dewy morning, she stepped onto the porch, turned toward the roses, and her heel slid. A fractured wrist later, she told me they were comfortable, just not safe. Comfort had tricked her out of stability. Your fix is immediate and powerful. Treat shoes like safety gear. Choose closed back designs, firm heel counters, non-slip rubber outsoles, and low, broad heels. Replace pairs when the tread moves out and wear stable footwear indoors on hard floors. The first place your balance fails or succeeds is under your feet. The next mistake is even more surprising because it isn't under your feet at all. It's inside your bloodstream. Number 9, skimping on hydration and triggering dizzy drop-offs. Dehydration in older adults is sneaky. Thirst cues blunt with age, diuretics increase fluid loss, and a single hot day can turn a steady walk into a slow carousel. When you stand, blood momentarily shifts downward. If volume is low, blood pressure can dip and the brain gets a second of not enough, which you feel as lightheadedness or gray edges. Studies in the Journal of Gerontology and related aging journals associate even mild dehydration with impaired postural control and slower corrective steps, exactly the milliseconds that prevent a fall. Marlene is 76, a retired school secretary who lived on coffee until noon. She felt floaty when she stood to cook and once slumped to the floor beside her stove. Her labs showed hemoconcentration, and she confessed she barely drank water. We added a morning glass by the toothbrush, another on the counter, and a small electrolyte drink during hot afternoons. 2 weeks later, she laughed, "My kitchen stopped tilting." Your fix is rhythm, not chugging. Steady sips through the day, a glass on waking, one at lunch, one mid-afternoon. Herbal teas count, alcohol does not. If you take diuretics or have heart or kidney issues, ask your clinician about the right daily target. Hydration is an invisible hand at your back when you stand. If water can steady your brain, the next mistake unsteadies it chemically, one pill at a time. Number 8, stacking medicines that sedate, spin, or drop pressure. I'm pro-medication when medicine is needed. I'm against the quiet way combinations steal balance. Sleep aids, some painkillers, certain anxiety or depression medicines, blood pressure pills, bladder relaxants. Alone, each can be appropriate. Together, they can fog thinking, slow reflexes, and trigger orthostatic dips. Multiple observational studies in the Journal of the American Geriatric Society and Age and Aging link polypharmacy, often 5 or more daily drugs, to increased falls, particularly when sedatives or anticholinergics are in the mix. Patricia is 73, a retired bookkeeper on 6 prescriptions. She wasn't drunk, but her hallway swayed. We reviewed her meds, found a bedtime antihistamine she'd added for sleep, and a midday dose of a blood pressure pill that hit hard when she stood from the couch. Her physician deprescribed the antihistamine, adjusted dosing times, and the room stopped tilting. Your fix is partnership. Once or twice a year, do a brown bag review. Bring every bottle, prescription, OTC, supplement, to your doctor or pharmacist and ask, which of these raise my fall risk? Can any be reduced, switched, or spaced differently? Never stop meds on your own. Small supervised changes can make big balance differences. If chemistry can wobble your stance, the next mistake weakens the very engine that catches slips, your muscles. Number 7, skipping strength training and letting sarcopenia win. Walking is wonderful. It is not enough. After midlife, muscle fibers shrink and power fades, especially in hips, thighs, calves, and core. That loss, sarcopenia, is one of the most underdiagnosed drivers of falls. Resistance work doesn't just grow biceps. It teaches your legs to explode into a corrective step when your toe catches a rug. Trials and cohort studies summarized in the Journal of Gerontology and Electrocrine Reviews show progressive resistance training improves gait speed, chair rise time, and fall outcomes in older adults. Helen is 68, a retired florist who walked daily. She tripped on a parking lot divot and couldn't save the stumble. Her physical therapist started sit-to-stands from a chair, heel raises at the counter, wall push-ups, and gentle step-ups at the counter. 8 weeks later, she could stand from low seats without hands and negotiate curbs with the confidence of a decade earlier. Your fix is small and consistent. 2 or 3 short sessions per week of simple strength, 10 sit-to-stands, 10 heel raises, 10 supported mini squats, repeated twice, plus a brisk walk. If your knees or back fuss, ask for a referral to physical therapy for a personalized plan. Strong legs are shock absorbers. Weak ones are warnings. Build the engine, yes, but also clear the road. The next mistake hides where you live. Number 6, accepting dim, uneven lighting and visual surprises at home. Balance is a 3-part symphony: inner ear, proprioception, and vision. When the lights are low, the music drops a section. Aging lenses scatter light and pupils react more sluggishly. Older adults may need twice the illumination to see the same detail. Environmental health and home safety studies, including work cited in the Journal of Environmental Health, associate poor indoor lighting with nighttime falls on stairs, in hallways, and between bedroom and bathroom. Eleanor is 76, a retired Corps director who shuffled at night to feel the floor. A throw rug turned into a magic trick and disappeared under her foot. After a fractured wrist, her son installed bright, warm-tone LEDs, motion-sensing nightlights, and under-cabinet strips in the kitchen. She told me, "I didn't know my house was this safe." Your fix is bright and boring. Raise bulb wattage within fixture limits. Add night lights along paths you use after dark, and be ruthless with shadows on stairs. Keep glasses prescriptions up to date and ask your optometrist about contrast-enhancing lenses if cataracts or macular changes dim edges. Light is mobility. If sight can fail the symphony, the next mistake silences the conductor, the inner ear.
5. Ignoring vestibular, inner ear warnings. The inner ear is the body's level and gyroscope. Tiny canals sense rotation. Crystals help detect tilt and translation. When crystals drift, benign paroxysmal positional vertigo, BPPV, when inflammation strikes, vestibular neuritis, or when both ears slowly weaken, the world can lurch, spin, or lag. Studies in the Journal of the American Academy of Audiology and Rehabilitation Literature show untreated vestibular disorders greatly raise fall risk, while targeted maneuvers and balance therapy restore stability for many. Dolores is 71, a retired bus driver who felt the room tilt when she rolled over in bed. She chalked to age until she missed a step and fractured her hip. In clinic, a quick Dix-Hall-Pike test confirmed posterior canal BPPV. After Epley maneuvers and a week of vestibular exercises, her spins faded. "I wasn't clumsy," she said. "I was miswired." Your fix is to respect dizziness. The room spins. I'm pulled to one side. Turning my head triggers it. Those are vestibular clues. Ask for an evaluation and, if appropriate, canalith repositioning maneuvers and vestibular rehab. Aging isn't supposed to spin. If it does, we treat it. Even when ears and eyes are tuned, nerves must deliver the message to your feet. The next mistake numbs that line. 4. Overlooking numbness, tingling, and the wooden floor of neuropathy. This is the habit that scares me most because it hides falls in plain sight, accepting numb feet as just aging. Peripheral neuropathy, often from diabetes, B12 deficiency, chemotherapy, alcohol use, or idiopathic causes, blunts the feedback your brain needs to place each step. Without that live map, you stomp or slide. Clinical studies in the Journal of Diabetes and its Complications and gait analyses in older adults link sensory loss in the feet to slower protective steps, wider gait, and higher fall risk. Georgianne is 70, a retired baker who said her soles felt like boards. She walked fine until she didn't. We tested sensation, found reduced vibration and monofilament detection, tuned her diabetes plan, corrected a low B12 level, and sent her to therapy for balance drills that didn't rely on sensation alone. She swapped smooth socks for textured insoles she could feel through, and her confidence returned. Your fix is to name it and treat it. Tell your clinician about numbness or burning, screen for causes, A1C, B12, thyroid, alcohol use, medications. Protect feet with well-fitting shoes and textured insoles, and practice balance with vision and vestibular cues on purpose, ideally with a therapist. Feeling your feet matters. When you can't, you train around it. If nerves can go quiet, bones can shout. The next mistake leaves your skeleton underarmed. 3. Letting vitamin D and B12 drift low, and bones, mood, nerves with them. I'm not here to sell supplements. I am here to prevent brittle bones and wobbly nerves. Vitamin D helps calcium absorption and muscle function. Low levels associate with falls and fractures in older adults. Vitamin B12 supports nerve myelin. Deficiency mimics neuropathy and causes weakness and impaired proprioception. Meta-analyses and trials discussed in journals like Osteoporosis International and Neurology link insufficiency with gait disruptions and falls, while showing that repletion in deficient patients improves function. Benita is 75, a retired seamstress with vague thigh weakness and shuffling steps. Her vitamin D was low, her B12 lower. With diet changes, supervised supplementation, and a strengthening plan, she traded inching for striding. I thought I was just old, she smiled. Turns out I was underfueled. Your fix is to measure, not guess. Ask your clinician whether you should check vitamin D and B12 based on your diet, sun exposure, medications like metformin, which can lower B12, and symptoms. If you're low, correct under supervision. More isn't better, targeted is. Strong bones and sharp nerves steady the frame. Even with good fuel, we can fall for speed. The next mistake is a rush that drops pressure and you. 2. Popping up too fast and courting orthostatic hypotension. I've watched proud, independent women stand from bed, take 2 steps, and fold like paper. Orthostatic hypotension, a sustained drop in blood pressure on standing, steals blood from the brain just long enough to gray the edges. Dehydration, meds, Parkinson's, diabetes, and just got up too fast all contribute. Studies across geriatric literature, including hypertension and aging, associate orthostatic drops with falls and fractures. Lois is 79, a retired piano tutor who leapt up when the kettle whistled and awoke on the kitchen floor. We measured her sitting and standing pressures and saw the dip. Her cardiology team adjusted doses, added compression stockings, shifted heavy meds to bedtime, and taught a rise routine. Sit at bed's edge, do ankle pumps, stand, pause, then walk. No more floor. Your fix is choreography. Rise in stages, pump calves before standing, pause for 3 deep breaths, and take that first step with intention. Review meds that can worsen drops, ask about compression socks, and keep water or your clinician-approved fluid goal on board. Rushing is a balance thief. All these systems might be ready, and still a simple hazard can win. The final mistake lives where you do and yields to a weekend's work. 1. Living with tripwires, clutter, cords, loose rugs, and mismatched surfaces. No villain is more stubborn or more fixable than home hazards. Loose throw rugs that buckle at the corner, electric cords snaking across walkways, pet bowls that migrate, thresholds that lift a 1/4 inch where tile meets wood, these are the ambushes. Environmental fall prevention studies referenced by the Centers for Disease Control and Prevention and Rehabilitation journals show targeted home modifications, decluttering, securing rugs, adding grab bars and railings, raising seat heights, cut falls meaningfully, particularly when combined with strength training. Janet is 80, a retired postal clerk whose living room was a museum of love, quilts, stacks of magazines, a footstool her grandson built. She tripped on the stool while carrying laundry. After a fracture, she let herself grieve and then transform. Non-slip backing under the rug, cords tucked and fastened, grab bars by the toilet and shower, a bright strip on the first and last stair. She said, "It feels like my house is on my team." Your fix is a home walkthrough with honest eyes. Clear pathways the width of your shoulders. Secure or remove throw rugs. Coil cords against walls. Add rails on stairs, grab bars where you turn, and contrasting tape on edges. Ask your doctor for a referral to an occupational therapist for a formal home safety assessment. A safer home is future you thanking present you.
Most balance loss isn't random. It's cumulative. Worn shoes mute traction, low fluids dim brain perfusion, stacked medicines fog reflexes, shrinking muscles slow corrective steps, dim rooms hide edges, neglected inner ears lie about motion, numb feet erase feedback, low D and B12 sap strength and sensation, standing too fast steals seconds of blood, and homes full of small surprises finish the job. Change any one and you stand steadier. Change several and you change your future. Falls don't only break bones, they break confidence. But nothing in this list demands perfection. It asks for attention, for a glass of water, for firmer shoes and brighter bulbs, for a medication review and 5 minutes of strength practice, for courage to say, "The room spins," and to clear the path your life deserves. I've watched women in their 80s become steadier, not shakier. You can too. Tell me in the comments, how old are you and where are you watching from? And be honest, have you ever made one of these mistakes? Your story might be the sentence another woman needs tonight. If this helped, like the video so it reaches more seniors and subscribe for more science-based senior health tips. We're building a community where wisdom stands tall. I'm Dr. Sarah. Thank you for trusting me with your time and your steps.